Okay, good afternoon, everyone, and welcome you all to the panel discussion on substance abuse, is women, church, and family. Let me give time to Mr. Abu Mere, Regional Director, Northeast Kripa Foundation, for the opening remarks. Abu, please.
Yeah, thank you very much. Good afternoon, everyone, and I welcome each and every one of you in this panel discussion. At the outset, I wish to thank the moderator and all the panelists for taking out time to share your valuable knowledge and experience. Today's virtual panel discussion is organized by Kripa Foundation in collaboration with Prodigal's Home and Social Welfare Department, Government of Nagaland, on topics substance use and abuse in the life of women, the church, and the family in the context of Nagaland. Today's panel discussion should serve as a new beginning of a joint effort of state government, churches, NGOs, and health activists to recognize and address the specific needs of women who use drugs and identify appropriate ways to reduce the extent of harm associated with substance use. Women who use drugs continue to face challenges that increase their vulnerability to HIV and other comorbidities due to high level of stigma, multiple stigma, institutional and societal, and discrimination because of the cultural prejudice and the lack of public, religious, and political support for gender-sensitive service in Nagaland. Women who inject or use drugs are often described in terms of their risks for HIV, viral hepatitis, and other sexual transmitted infection, but limited or no access to harm reduction, drug dependency treatment, sexual and reproductive health and rights services, and general health services. It is thus essential that gender-sensitive service, non-judgmental, sexual and reproductive health and rights service be put in place. I look forward to gaining a deeper understanding of issues confronting women who use drugs from the risk experience and expert panelists. We expect today's deliberation to highlight the ground realities, challenge health disparities, the vulnerabilities pertinent to this specific population. This will guide us in designing and implementing key intervention for public, private, and religious program. Recognizing women who use drugs as the experts in their own life, meaningfully involving women who use drugs in the design, implementation, monitoring, and evaluation of programs, and oversight of relevant research and policy service affecting them is a paramount urgency. We need to ensure eliminating or reduction of cultural prejudice, stigma, and discrimination to scale up women who use drug-friendly services. There is a clear need for systematic and comprehensive advocacy and implement strategies and policies for meaningful involvement of women who use drugs. It is imperative to ensure that appropriate services are made available to women who use drugs in harmony with gender equality, human rights, universal public health, and sustainable development goals, frameworks. The government of Nagaland should take these needs into account and formulate appropriate policy accordingly. I strongly believe that today's panel discussion will empower us with greater understanding of the challenge that confront women who use drugs and bring forth new ideas and strategies that will enable the state government, social welfare department, churches, and NGOs to comprehensively address the urgent need of women who use drugs. I wish all the very best to all the panelists and participants in this panel discussion. Thank you all.
Let me introduce our panelists for today's discussion. The first will be Ms. Anna Hairang, Program Officer, Northeast Technical Support Unit. She will share on substance abuse and women, reality and ray of hope. Second, Ms. Sintina Ayer, who is a counselor as well as a therapist. And her topic will be on substance use in the church with emphasis on women ministry. Third is Dr. Joyce Ankami, President, Nagaland Medical Council, and she will share on the topic substance user and reproductive health issues. And fourthly, we have Ms. Vitono Haralo, social activist and founder, Pathfinders. She will share on alcoholism and addiction, my encounter and responses. Let's welcome Ms. Anna Hairang, Program Officer, Northeast Technical Support Unit.
Hello and good evening to all. Moando amido ki kuriya da amiando NGOs te kam kuriya se we harm reductions program kuina drug addictions and HIV program de amian kam kuriya se. So ami topics aji amige kuta ko lado substance abuse among women kuina. First point to kia se kulida. Why do women use drugs? Amian maikigan. Ki karne drugs use kure kuina itu ekta points ase. The second point, why are women more vulnerable for addictions than men? Maiki kwado, why are maiki kuishi gulido kile bishi risks hui jay addictions te giri bole mutabara bi bishi amiane risks te hui jay maiki wado. So don't itu second point that we discuss pro munja se. The third point is amian ki kro parwa as a woman, as an individual or as a woman. Amian ki kro parwa ekta maiki substance abuse kurala maiki ekjunge amian ki support dibo parwa. Itu tinta topics pra lina tinta points lina ami aji discuss kro munda se amian sab lo de. First point, reason why women use drugs. Amian maikian ki hone drugs use kure kulena. Like any other man na alak muta nishna amian bi maikian bi we feel loneliness, depressions itu warna bi or fatigue na kam kuri na tired wina amian itu karena be nilbi amian nijila self esteem do low hui ja na nilbi amian mala life the problems kisim being a woman amian maiki ekta wina amian life the problems alag ahe so itu alag adem de amian itu cope up corona para hoi ja amian la lifestyle karne lifestyle de amian cope up corona para hoi ja so itu karne other reason is mala in case like mala partners mala husband ho pare mala partners ho pare whom we are in relationship so in them the mala partners or in their partners can drugs khai kuishigle da amian mon maiki gando more prone hoi ja aro drug addictions te girulela nilbe amian maiki gan like we have lots of body image issue amian nijila body maikian nijila body image bi balna lagina so at that point of time dawai khaina bi tan patla hola or maybe like social media right influence wala so itu arna bi ho pare maybe chronic pain de mu ide common thala do mon maikian ekta hoina amian la kisim amian lo de problems ai dage so at that point of time chronic pain hoina amian idu manage ko na parina itu arna bi amian addictions te giro pare when it chronic pain de mu alop mu share ko mun thanga la do ekta I was I turn sang fane daishe when I went for my office la duty arna mujalne ekta maiki buri ekta nearly at the age of 60 years te daishe so it is 60 years buri do kyane tai dawai khawle saru jise kyane ta addiction hishe ko namu tai kuta kwa dande what I found out was this tai kiti buri live they have a huge responsible. So in them like DJ again. Kiti jarne kiti ran kam kuri dhande. Ki huishe gulido. Tai giri jay na tai la bodan tai accident na giri jado tai la ido giri jay na bedridden huishe. So at that point of time tare bustire thaka mano mutan alo butmas kan tage drugs kilaise. RP kilaise, which is also misuse kore do drugs pe. So itu kilai na ta aste kuna ta addictions te giri she kuna. And then the other reason is sexual abuse. Amian maikian we are more prone for sexual abuse. Ine wande traumatized huina amian ine wadem debe the way drugs addictions te giule la chances bishi huije. Now amian maikian kuishe gule the literacy rate bishi kumti dage. So bishi bak maikian chukrian do ki huye gule the basic educations to it and basic educations be complete grow na para la bi huije. So at that point of time ki huije ta la gola kam do bishi ola focus wina ta la gola kam do saule la krule la ine hodem de ta la nije la helpi ignore krule start huije. Why are women more vulnerable for addictions than men? Amian maikian do kiane bishi vulnerable huije mutan brabi. To saishe guli do the first point is amian maiki isrovamon ke bana dem de biologically different amian ge alak banaishe. Amian ge so idona amian bishi sensitive huijaro sensitive to the effects of drugs because of our sex hormones one of the sex hormones karne idona bi contribute vulnerable huija risks huija amian drugs addictions de girula. The second point is amian maikian do the way drugs kado a lot dose kumti dose te khaishe gulibi for a short period kumti period per khaishe gulibi mutan lo de compare krina idu iman kumti khaishe gulibi amian maikian do more addictions te girula more chances ase agire condition because of biological difference aro mon la emotions maikian mo idu bar kwe dage ko jeshe gulibi maikian do they have a big heart na and then they are very emotional maikian do bishi emotional hoja so it emotions karne bi tan get trigger kre na emotions tan la emotional conditions karne bi tan ge trigger kre and then because tan it experience kuina tharne tan more prone hoja more vulnerable more risk hoja mutarabi and then anxiety and depression stage saishe gulibi maikian do mon restless not restlessness I won't call it but mundu kuina problems kan ba khang ami khang maikan la khang do bishi bari hui jai so bishi bari thage so because of that depressions kan dibe tan bishi giri jai gira dem de tan ido substance ido abuse kur labi chances bishi hui jai. The third point that I wanted to discuss is what can we do amian ki grow parwo maiki gan who are into substance abuse amian ki grow parwo kelido first amian bujio lage amian understand kule lage ki addictions to bimar ekta ase like any other disease like diabetes ho pare it bimar do treatment unless it is treatment lo na kule the bal na hobo so idone amian addictions bi ekta bimar ase bina amian bujio lage really be amian society de saishe gule do addict ekta amian ge addict agent ge saden de drug addict agent ge amian saden de amian itu do kam na ta manu ase morally weak ase na tala willpower na ta manu ekta ase immorally weak manu ase kuina or especially my ke ekta ase gule do ekdam tan ge ghin kuina tan ge sai amian as a society amian society and drug addict inia sala do inia fane bishi sai so done ki hoi jay gule do shame sorom lagina guilty stigma discriminations kanbra to itone amian maikian ge bishi ba treatment lo le la tan treatment lo de tade rukai de amian maikian ge rukai de treatment jawo gulibi society an ge fear kura amian la gor manu ki babio mula busti manu ki babo colony manu ki babio itula bukhina treatment jawo guli treatment na ja hoi jay amian ne de saise guli do every 5 men pasta mutade only one ekta makie treatment de awule parala dikiase amian itero amian tange female la access makian ge access kula tan itu improve kula time wishe we need to support them economically. Amian support kula time wishe. Amian ide amian सब manu ide aina participate ide kruina takaange. Amian सब manu encourage kru munja se. I be सब manu aina. Let's try to understand addictions as a disease. Amian सब manu addictions to ekta bimar se. Unless you support, unless I support, amian la maikigan, amian la amagan, amian la chukrigan do treatment de awona parwo. Idona amian ge encourage kru munja se. Gede aina taka manu kumba drugs use kuriya se nege. Don't hesitate. Kutakuwe, talk, and then seek help. Modot mangiwe. Apni nilibi apni kunma manuge jani asinige drugs kaya se kuina. Then in that case, jabi tan lode support krubi, tan lode kutakuwe. Listen to them and then let them know. Tan ge janai dibi ki idula struggle de tan ekla no hoy kuina idu janai dibi. Encourage krubi tan ge motivate krubi. The tan treatment de jawo lage. Treatment de jabi kuina abnian encourage kru lage. Amian la maikian ge amian encourage kuina tan nijeba kara tan a thing de kara ko parishi gulido. We can help them restore her life, her family, and then amian la society as a whole. So
it's a joy to be with all of you today. I'll be talking about substance use and the church response. So what I want today is for all of us to reflect on how to bring about a better Christian involvement and response for positively impacting and transforming the lives of individuals and families affected by substance use disorder because of a lack of awareness as well as stigma attached to individuals or families who experience the ravages of substance use often do in shameful isolation. So there is a lot of shame and fear to share their burdens with society or even fellow church members. While some who do reach out often struggle with acceptance and a sense of belonging, since the society in general is non-accepting of them. Hence, in order to ease some of their burdens, we need to try and understand what substance use disorder is and how it affects an individual and their families. I would like us to look at the definition of substance use disorder according to the Diagnostic and Statistical Manual for Mental Health. This is the 5th edition. So it says a pattern of substance use disorder is a pattern of symptoms resulting from the use of substance like alcohol, nicotine, marijuana, whatever drugs available that one continue to take despite experiencing problems as a result. So effects of substance use disorder. Substance use is just the tip of the iceberg. So underneath that, there's a lot of other issues that a women has to go through. So actually understanding addictions is not an easy task. There's so much complexities involved in it. And it frustrates and challenges most of us, in fact, because it has devastating effects across demographies, boundaries, and families. It affects everyone. So when trying to understand women addicts and women who are victims of addicted partners, it's not just women who use substance, but also those women who are under constant strain because of their spouse or their brothers or fathers or mothers using the drugs. So we need to be aware that the impact of addiction or its effect are quite different in women and men according to biological reasons, which Ms. Anna has already covered. So looking at substance use in women substance users are likely to experience faster substance intoxication, and they have all these health issues like cirrhosis of liver and breakage of bones, heart problems, and also mental health issues like depression, anxiety, eating disorder, low self-esteem. And what we need to be aware is that even pregnant women who use substance might experience increased rates of spontaneous abortion and low birth rate or premature birth of their children. And most of the time, the infant will exhibit some behavioral problems as they grow older. they suffer a lot of emotional, mental issues, and suicide rate is also quite high in women who use substance. And when we look at the violence, we we must be aware that there's a lot of sexual assault, rape cases going on with women who use drugs as well as who don't use drugs also. So someone who is using drugs or alcohol will exploit the women, physically abuse, mentally abuse. So all that is going on. So when it comes to family system and the society, addicted women experience over responsibility within their family of origin. So because of high levels of familial strife, and they are often discouraged from seeking treatment by their own family members. So women entering treatment are less likely than men to have family support, and also lower socioeconomic status, less education, and employment are common issues that women face. And they have a lot of issues like additional problems like lack of childcare and cultural stigma, financial limitations, and all those things. And we must not forget that women in rural areas suffer more due to lack of awareness, treatment facilities being not available to them. Okay, just let's go to the Christian response. I'll be looking at this 6 points that I have listed here. Spiritual strivings and religious beliefs compromise most of the profound and fertile areas of meaning in people's lives. So the church can significantly influence people's orientation and play supportive roles for them. So instead, like Nagaland, if we look, with majority of the individuals being believers, the church can in fact, and it does have much to offer. And moreover, the church is the only caregiving, helping institution that has access to half of all the Naga families every weekend. So why not make ourselves available to make greater impact in the lives of people who are going through a lot of distress? I'd like to look at the first point here, restorative community. These are some of the practical approaches which the churches can adopt. So substance users and their families often find themselves alone or alienated. So as Christians and relational beings, will it not make sense that part of the response would be to offer a restoring community to someone who is alienated? So some elements of restorative community is love that is personified. In a restoring community, love is not discussed. It's not just discussed and left aside like that, but it is embodied by the members. It is full of grace delivering community. The community has overcome the human tendency to make judgment. Their intent for delivering grace is redemptive in nature, safety providing. So people who struggle with substance use often experience mental illness. So it's kind of a comorbid, because mostly when you are using substance, you will tend to have one kind of mental illness or the other, or when you have a mental illness, you might turn to substance use. So, and even their children and other family members suffer as well. So hence, in this community, the restorative Christian community, they're given a safe place where they can be accepted unconditionally and given full support. So when we extend trust upon those who struggle with substance use, growth towards recovery is realized. The next point here is support groups. So the church actually can organize support groups that will minister to those who struggle with substance use and mental illness. So it's more of a mobilization. So when we say community mobilization, it can be one of the key programs in substance use prevention. So this strategy is intended to increase community awareness and engage communities in prevention activities and actions to moderate use of harmful products among women and those infected by it. So through community mobilization, the church teaches women and families ways to recognize situation where they are likely to experience pressure due to substance use. So the women can be taught ways to avoid or otherwise effectively deal with this high risk situation in their lives, preventive approaches, as well as health strategies and activity-based substance use prevention programs can be inducted into this community mobilization. The third point is task force. So develop a task force who will intervene in psychological crisis and include a pastoral staff whose responsibility is to offer training and counseling. So giving training, focusing on providing tools to groups of people who can assist people going through the substance use disorder. So the counseling training should be specifically arranged, targeting and keeping in mind the individuals and families with substance use disorder or those who are victims of it. So there's a whole different kind of counseling approach for people who use alcohol and drugs. So those kind of training should be provided to some few people in the church who can assist and who can further train other people to continue doing the same work. So because in most cases, a person with substance use disorder, like I said, will have some mental health issue, or the family, the wife, the children of substance users will exhibit mental emotional imbalance and other behavioral issues as a result of experiencing first-hand trauma at the hands of person using the substance. For example, I'll give you an example here. There was a particular boy who was in a counseling session with me. I'm sharing this because he's not from Nagaland. And what happened is that he had kleptomania, he was stealing, he was causing a lot of problem in the school, he even burned himself, and there was a lot of behavioral issues going on with this young boy. So on trying to understand what was causing all this disruption in his life, it was found out later that both his parents were into alcohol and drugs. So that was his way of gaining attention, as well as regulating his happiness in a way. So we know that it's not the person alone who uses substance that needs help, but even the family members, the children, and everyone involved. And also the church should also work to improve their provision of a loving and caring community for the victims of drug and alcohol use, which also include reconciliation with their families. So often the person who is using substance will cause a lot of heartache and sadness to the family, to his or her immediate family, and they might reject him, they might abandon him. So it is important that we focus on the reconciliation between the families of the person who uses substance and focus on rehabilitation services for all of them. And my next point is include substance use and mental illness as themes in church education curriculum. So biases and community stigma, as mentioned, can discourage people with substance use, life-saving medication treatment, or engaging with harm reduction efforts, often leaving them isolated. So church can serve as a place to address those misconceptions and educate community members on the reality of education on addiction. So they need to provide that education to the general congregation. So church leaders can help foster a culture of understanding and support of evidence-based care. In many places, churches have long hosted support groups for people and families struggling with addictions. Many people in recovery rely on both spiritual and secular support, especially in places like Nagaland, where most of the people are Christians. So groups such as Alcohol Anonymous or the Narcotics or the Codependent Anonymous to provide structure and community while facing the cyclic nature of addiction. And for women, there is the Women for Sobriety group, which is similar to Alcohol Anonymous, but it has 13 steps instead of 12 steps, which we find in Alcohol Anonymous. So all this can be included and involve and educate women and their husbands and parents and families and children who are addicted and affected on the associated risk as a strategy to strengthen the foundation of taking care of the affected and as well as management of substance abuse by either themselves or their families. So public awareness campaigns plays a significant role towards substance use prevention. And drug use prevention programs, seminars, psychoeducation, like the one we are doing now is also kind of a psychoeducation on substance use disorder, mental health, trauma, codependency, which is a #1 trait when it comes to the substance user and the relationship within the family. The dynamic is of codependency. All this will go a long way in fighting against these issues. And also, it would be good for the churches to provide forums where those who are recovering from substance use and their families can share their testimonials. Because some people I've encountered, they felt that they will be more responsible if they share about their drug use and recovery to the larger audience in the church, and they feel that that kind of support will motivate them further to remain sober. So that was a good insight actually even for me. And the last point is network with other churches and bodies who share similar goals to enhance the lives of those who are struggling with mental disorder. So networking is so important even within the church if they can network and with different NGOs, and because effective treatment for substance use disorder is still scarce in many parts of Nagaland. And people with substance use disorder, and especially those in the rural areas, have a high risk of overdose and face many barriers to accessing treatment and the proper care needed. So even in the villages, if we see, there's still they still use those old outdated methods where they put the person inside a small cage, and also I don't think that is quite practical. And even or some are even chained to their beds or chairs and kept like that just so that they will stop their addiction. So it's high time that we break out of all of these, and the church can play a very vital role. And one promising approach to bring substance use treatment to their communities, to such communities, is partnering of faith-based organizations to NGOs and organizations working on addictions. So churches, to many people, serve as a hub for social connection, dissemination of information, and influences, attitudes, all of which are key to addressing the addiction crisis. So many churches are not strangers to substance use crisis. And despite the controversy among addiction medical professionals, evidence shows that religious participation can be a protective factor in recovery. And that is wonderful news, because for someone who is who is an addict and in a recovery process, the protective factor plays a very important role in how long that person is going to stay sober. So it is well founded that faith-involved treatment delivery can have positive impacts on community prevention and treatment of substance use disorder. So delivering treatment that honors and respects the belief of the population is important to treatment retention, building relationships, and improving outcomes. So here, churches should closely network and focus on expanding and strengthening their collaborations with hospital systems, public health, non-profit and public safety organizations, rather than church as a standalone program provider. And they can even appeal for funding and training of its personnel from government and other non-governmental organizations. So those are some of the key areas which the church can look at and, if possible, introduce it slowly into their curriculum. Yeah, so that's all for now. And later, if you have any questions, you can ask. So thank you so much.
My subject is quite an interesting one, but it is very hard to find references, particularly into our local context. And therefore, I'm just going to base, just for our own reference, I just want to go back to what is being found in CDC statistics. You know, it's hard to get statistics in our region, but CDC has a few statistics. And so I'll just share that with you to start with. And maybe later on, I'll share the local context, what has been found. Now that in the CDC reported that, you know, they did a survey of all the women, particularly women who drank alcohol in the last 30 days. And they found that 46% of them had used alcohol. When I say alcohol, that is inclusive of other substances as well. But I'll just sort of, for simplicity's sake, I'll just continue with the alcohol, the subject on alcohol. Okay. So 46 of the women who were interviewed had used alcohol in the last 30 days. And approximately 12% of them binge drinking, because they drink heavily. 12% of them drank heavily, which means they had the binge sessions at least 3 times a month. And what they found is 90% of those who had binge drinking, they were not alcoholics, neither are they dependent on alcohol. But 5% of them were alcohol dependent. Right? So what has this alcohol use affect the outcome on the reproductive health? And they have found that 1 out of 2 women of childbearing age, that is from 18 to 44 age, drank alcohol, out of which 80% of them binge. Now, when I say binge, it means that they drink excessively. When they look into this, excessive drinking may disrupt actually on the reproductive health, may have problems with female menstrual cycle, as well as, you know, may cause infertility. That's what we have found. Now, binge drinking is likely to have binge drinking. Those who are involved in binge drinking were likely to have unprotected sex, which may, or they may have multiple sexual partners, or they may be sexually abused in some ways. And so which resulted in unplanned pregnancy, unwanted pregnancy, and also the risk of contracting sexually transmitted diseases like HIV. Now let's come to the place where the pregnancy outcome is. 30% of these women drink alcohol. I said 10%. And increased risk, those people who drink alcohol have increased risk to the baby of having fetal alcohol, fetal alcohol spectrum disorder, FASD. And the most severe of them is called fetal alcohol syndrome. That causes mental retardation as well as birth defect. Now, FASD, which is fetal alcohol spectrum disease, is completely preventable if women do not drink while pregnant. It is not safe to drink at any time during pregnancy. Okay. And then when they found that excessive drinking increases risks as it has already been mentioned. The risk of having miscarriage or stillbirth, a child that is born dead, or premature labor, which means the women go into labor pains before the baby is due. Now, the women who drinks alcohol whilst pregnant, more likely to have a baby die from sudden infant death syndrome, or in other words, it is called cot death. That is without any sign of symptoms at all. The baby will be put to sleep and suddenly they found that the baby is dead. And there's been a lot of investigation into cot death or sudden baby death syndrome, but no causes have been found. They have not been able to elicit what causes the sudden baby death syndrome. Okay, and so this sudden baby death syndrome is most likely if the woman binges in the first 3 months of pregnancy, because the baby is just developing then. Okay, when I said I'm talking a lot about alcohol, this also includes the drug abuse as well. Obviously, there's a little slight difference, but taking the statistics as a reference, I just want to come back and share some of the local findings that I have found. After I was given this topic, I began to talk to the gynecologists as well as the pediatrician. And the pediatricians are child specialists, and one in particular, she was a lone pediatrician in Kohima. This is in Kohima context that I'm talking about. And so I just asked her, have you found any body or any pregnant women coming, delivering babies, and what has been the outcome of those people? And she said that prior to 2007, she found that many of these women who come to give birth, they will give birth to good sized babies, healthy babies, and then within 24 hours, they are dead. And so that really caused a lot of puzzle and puzzled her a lot. And so what they do is that she started taking the history. This history of where the location where they live, and then their occupation, and when they came to occupation, they found that majority of these women who had whose baby died within 24 hours were from a particular region called a particular area colony called New Market area. Okay, now this New Market area is famous for local rice beer, right? Pitamodu as well as care, we call it care, okay? And they found that, and they drink a lot of, all of them drink, husband and wife also, they drink, and they sell. They make a livelihood out of selling the Pitamodu as well as care, we call it care, okay? And of all the care, what is most popular among them is called Ruhi, the first liquor that comes out of the care or the rice beer, right? That is so strong. It's really quite strong, but it is quite, it just gives you the kick. All right, and so majority of these women, they began to identify the location. They began to identify the occupation, and they also found out that they drank a lot during pregnancy, right? And so once they discovered that, the pediatrician started saying that, okay, since this has baffled us, what we'll do is as soon as children are born, babies are born from this group of people from this particular colony, we are going to design some intervention. And what they did was they took the child to intensive care unit and started giving them Instead of mothers feeding them, they started giving the IV infusion, which means injection, along with vitamins, plenty of vitamins. Because the mother, she may be looking healthy, but what the baby is deficient of is the necessary vitamins, and it is affecting the brain. And these babies would die suddenly out of shortness of breath. Okay. And so they started this particular new venture, and they found that the babies were surviving, and the parents were able to take the children home, but with a strict instruction that they will not breastfeed the baby. Why is that? Is because whatever they drink is coming out through the breast milk, and the baby is taking the breast milk, and the alcohol content in the breast milk is affecting baby, and therefore reducing whatever the baby is requiring for its growth and for its body. And so once they started doing that, they were able to save the babies, and they were able to go home. Now, one of the success stories that she shared with me is that a couple, apparently they had not been able to have children for a long time after they got married. So there was infertility in the couple. And then finally the wife got pregnant, and then she gave birth, but the baby died. It was a stillborn baby. And then the second one also happened, that the child also died. And so the pediatrician began to understand that this is because of the alcohol consumption. Alcohol consumption, that this is what is happening. And so she took matters into her own hand and talked to both the husband and wife, because they were both alcoholics. And so she began to threaten them, saying that, look, if you do not stop, when she said, you know, the Naga's way of counseling is that, you know, to make the husband as well as the wife responsible for the, you know, that if they want to have babies, that both of them have to stop drinking alcohol. Then only they can have live baby. And subsequent to that, both the husband and wife took her words, and she also threatened them, if you continue to drink and give birth to the next child, I will not take care of your child. That is a way of counseling. But you know, sometimes we have to talk tough, so that the future generation can be protected as well. So what she did was, after that they had 2 children, and she didn't breastfeed, and they stopped drinking, and they had 2 healthy boys apparently subsequently. And that was the success story of them. And I also personally came across 2 families where both husband and wife drank. And they have, the first couple, they had two girls, and they were born with very low birth weight, and it was very difficult to feed the first child, and it was very slow in growing. You know, low birth weight along with slow feeders, and then the growth rate was also reduced. But fortunately, for the first child, her auntie took care of her, and so they took her to the pediatrician, who actually looked after, monitored her milestones, and began to feed the child with vitamins and many other exercises. The second child also was born low birth weight and also had difficulties, but both husband and wife died from alcoholism, alcohol-related death. And so both these 2 girls are orphans, but they are being taken care of by the grandmother as well as the auntie. The second couple, who are also both alcoholics, and you know, they have several children. The first child is fortunately being taken care by the auntie, and so she is now doing well. She's going to school and is quite bright. The second child, who is a 4-year-old child, it was low birth weight. Yes, the father and mother drank, And obviously, if a mother is drunk most of the time, she will not be able to take care of the baby. And so as a consequence, this girl, the little girl, she is just alive, but is a vegetable. It's lying on the bed. So maybe she had brain damage as well as slow growth, and you know the milestones were not reached. And today she rests on the bed doing nothing, and then subsequently the mother had another baby which was given for adoption, and the final one she had a baby and it died. And so these are some of the sad stories that we have come across. And so we realize that not only with alcohol, I'm basing mainly on the alcohol because we have some knowledge about that. Now, when I asked the obstetricians and found out that, to find out whether they had had any problem with a pregnant mother who is an alcoholic, they said, oh, we don't know. They come, they give birth, and then they go away. And so they have never really followed it up. And so, very unfortunately, the obstetrician were not able to give us throw any light on the consequences of mothers who drank alcohol. But here, I just want to add about the withdrawal effect on a mother who is a heroin dependent. Heroin dependent, the baby can go through pregnancy and may be born, but the baby undergoes withdrawal effect. When there is withdrawal effect, I know that as adult men, we deal more with men here in our rehabilitation center. They also have terrible withdrawal effect. And the baby has become an addict in the mother's womb because of the heroin addiction. And the baby, for the next 14 days of her birth into this world, she would have this withdrawal effect and will cry most of the time. And this cry will be piercing shrills. It's very heartbreaking. And the baby had to be weaned off heroin addiction. And it is not only that, but other substances, the combination of as well alcohol as well as drugs can give rise to other deformities. It can be to do with mental defect, it can be to do with visual as well as hearing. Today we have a lot of disability. There's disability cases in our state is rising. Could this be because of our alcohol abuse and also as well as drug abuse? Now, what the final thing that I want to say is that, there is no safe time during pregnancy. Whilst mother is carrying babies, there is no safe time to drink alcohol, or there is no safe amount that the mother could drink alcohol. Alcohol has to be stopped because, the little baby is developing throughout pregnancy, and particularly the brain is affected. So here I want to say that fetal alcohol spectrum disorder or fetal alcohol syndrome can be totally and completely prevented if pregnant mothers do not drink alcohol and they stop alcohol, because then they can have a healthy baby and the baby can bring so much joy into the family, to the community, and to the society as a healthy baby can give us. And so that's all I will say for now.
Hi everyone, a very good evening. It's been a real privilege and honor to be part of this panel, and I thank Kripa Foundation and Prodigals Home for initiating this very, I would say, an essential conversation that needed much attention, and to see very well experienced people on the panelists getting to hear Anna, getting to hear Sentina and Dr. Joyce, and being moderated by Nukshi, and getting to hear from Mr. Abu. I take this opportunity to say thank you and in gratitude. I think the topic that was given to me was alcoholism and addiction, and my response with my personal experiences. I think most of the speakers have already touched upon many of the things that I had in mind. Um, but one thing that I wanted, where I feel that I can contribute right now is, I want to start with my personal experience and how I saw this whole substance abuse as a victim and as somebody who had both drug and alcoholism in the family. In terms of drug, I think my first introduction to this whole drug issue was as a child. I had my one of my relatives, and I just didn't understand. In fact, me and my siblings, we did not understand as a child what this substance abuse, or for that matter, what is drugs, and it really made us very uncomfortable. At the same time, hate the person. And we saw that very young, as a young person, and it affected the family a lot. That led to our adulthood. It was a mixture of alcohol that, again, I want to be very frank and honest here, which I feel it's important in this discussion. I come from a family who has both drug and alcoholism. My father was an alcoholic, and one thing that we really disliked was getting to face the evenings. And the evenings were very dark for us because we know what was going to happen. And it really affected our mental health. Well, in fact, we did not even know what mental health was because such things were not educated to us in the 90s. I'm a 90s child. I was born in 1981. And having to see all these things and not having conversation as a family and getting to see violence, getting to see our relationship being broken as a child and as I grew up, I can only speak for myself. It really had an impact in me, honestly. As a teenager, I started to have low self-esteem. I had issues with self-confidence. I had issues with not feeling worthy. I had issues with, I think, depression. The word depression came very late, I think just very recently. And it hit me so hard that as I was growing up, having no mentor and coming from a very unstable environment, in spite of staying in Delhi for 25 years, it really had an impact in the decisions that I made for myself. And the stories that each one of you have shared about women getting themselves into so many broken relationships, I think I also went through that phase where there was a sense of rejections, and I felt that I wasn't good enough in many things. And that led me to, I think, also drinking, which later on I discovered when I was introduced to an organization after coming back home in 2012. I experienced about how much hate and hurts were buried inside me that had actually governed and took control of the decisions of my life. And it was when I looked into the areas of my life where it had cracks, recognizing and identifying why I was an angry person, because I was identified and termed as the angry women. And I had a problem as a child. As a child, I'm speaking on in the perspective of a person coming from an alcoholic family and how it had an impact as an individual. Whenever I share, I get so emotional and sensitive to every little thing that when I speak, I start crying. And my parents, they would focus more on my crying than what I'm trying to share. And that became, I mean, even now I get very emotional about it. But that is a huge impact it has on a child and as you grow. And it becomes bigger as you become even an adult if it is not addressed. And it really affects as you, enter your adulthood and in the decisions that you make, in the relationships that you have. And this is something that I saw in my life. And by God's grace, with all the struggles, I'm sorry, excuse me, with all the struggles that I have gone through, I saw my own brothers going through that phase of alcoholism. We as a sibling, we went through our own situations, and we just didn't know how to have conversation, and we were filled with our own hurts, with our own pain, not just a family problem, but with our own individual problem, and we just didn't know how to talk about it. And I think as young adults, we continue to find ways to blame one another, and this is something that every family goes through. And what all of you have shared, we don't have family therapy. In the state of Nagaland, I can only speak for the state of Nagaland, we are so orthodox and conservative that to talk about family issue, it's a taboo in itself. And to let somebody know that you have an issue of alcohol or drug, it's so much of stigma is surrounded with it that even the person who is the victim to substance abuse is unable to come out and seek for help. And I say that with confidence because when I started working as a social activist after coming back home in Nagaland in 2012, having my own experiences and struggles, and then when I started to find healing of the hurts and wounds that I had received over the years, I had the opportunity to volunteer at a rehab camp, I think last year. And I went to Henikunwa. I extended my volunteerism there as a listener, as a counselor with my family therapy training. And I wanted to be available just to listen to the clients that were stationed there. And more importantly, because there were women clients in Henikunwa, where the rehab center is, the Operation Salvage. And the more I spent time, I realized that the lack of support, as somebody had rightly stated, that we have more support for men, but we don't have support system for women. There's immediate solution for men to go to the rehab or get medical attention or for all kinds of support. But when it comes to women, I think a lot of pointing fingers is on a huge, I mean, in a larger percentage. Now, after what I had experienced in that rehab is that it was an effort by the church, by many villages that is surrounding Henikunwa, who joined and collectively made this effort to bring women who are addicted to substance abuses. But the sad reality is it has root causes. And nobody is talking about the root causes. They're only talking about the end product. Nobody is talking about what caused the women to drink, what caused the women to sell alcohol, what caused women to face, go through the domestic violence, what caused, in her life to become what she became. The society, or for that matter, many people are not ready to talk about the root causes. And I think that's where the problem lies. And I think the solution also lies there. And it is not just about picking up someone and saying that, oh, you did this, so you need to go to rehab. And believe me, with my experiences there and with many other cases and in my own personal life, recovery is a process and it cannot be done overnight. And another thing that I saw, number 2, is the family support is so important for the person who is a victim to substance abuse. Because when you don't have a support system from the family, then it actually aggravates the position of the person who is abusing the substance, whether it's by choice or he's a victim. Nevertheless, as a person, as a family member, I think it's very important to give support, because I have seen this many a times when I was counseling the client and his or her family. The family just dumps the client, the addict, into the rehab camp, and you know, tells the rehab that, oh, it's all in your hand. Apuni khan lahat te ase, apuni khani sailubi. Mukhan time te ahi thakibo. Though that is the agreement that the family agrees to do a regular visit as and when it is required, and all the support system should be given in spite of the rehab doing their part. But unfortunately, many Naga families have failed to do that. And it becomes very difficult for clients' recovery also in the process. And there are many clients who are left in the rehab where the family don't even want to take them back. So a lot of rejection is there in this whole process, and the client has also less chances of getting better. I will not guarantee about that it's a total recovery. Something that I learned in the rehab was that, and somebody has shared here very truly, that addiction is a disease. And in the rehab, there was a signboard that said, hate the addiction, not the addict. It really changed the perspective of how we look at addicts. And that is something that we need to make our people aware and sensitize and educate, which is very less. And for any recovery to happen, we really need the support of everybody, but they have to understand what is addiction, what are the root causes. Another thing is when an addict or the client goes back, you know, after a certain period in the rehabilitation center, the rejection from the community, from the family, and the stigma that follows him or her makes it difficult for that person to sustain, you know, to be all right. And then he or she is tempted and provoked to go back to the old system, or perhaps come up with another alternative arrangements to get into addiction, because it's about survival. And the church really has a role to play here, because it is not just the spiritual fooding or feeding that is needed in this whole process, but I think a lot of love and compassion and listening is required. The church, as Sentina has shared, you see, the church, in my understanding, if they could reach out to people who eat pan, who eats, who takes alcohol, who smoke, all kinds of other things, rather than rejecting, why can't we build friendship? You know, these are some of the things that I have often seen in the church premises, that if somebody is taking all these things, it's like, oh, biya manu ase. Only the goody people will go to the church, or who gives tithes, you know, or who are full-time involved in the activities of the church. They are termed as better people. And many of these people who take substances of different kinds, they're rejected, and they feel that, oh, that's not the place for us. You know, we're not good people. So why should we go there? There were times when I feel like that, because I was totally rejected in many ways. But then by God's grace, my spiritual life helped me to recover in terms of my hurts and my pains and the struggles that I went through as a child, as a teenager, and as a young adult. And if I were to say that how I responded back, I want to say this by sharing that, you see, I have a brother, and this is a very personal story. And he's in denial that he's an alcoholic, and it's all right. But for 10 years, we suffered because of him. And along with him, I became a victim because he and I would have the worst friction. And I became the person who stood between my parents and him to protect both sides. But I landed up crushing myself, trying to save both parties. And I face mental harassment, I face physical abuse, I faced verbal abuses, even to the extent where I was even called names by my own. And that was the biggest hurt that I ever had. And I still remember running at midnight without my shoes just to save myself. I had none of my friends to help me. So I know what it is like as a woman. The society does not support you, the community does not support you, your own family does not support you. In fact, they tell you, they teach you, they condition you not to say anything. tolerate. There was a time when I couldn't tolerate anymore. I think 10 years is quite a long time. And I wanted to file an FIR, but my parents stopped me from filing an FIR because they said that, Gugu, you got to stop this. You being a social activist, we understand, but you can't do that. I come from an educated family and I have seen the worst of worst. I think as a victim, as a family member, I had no one to talk to. I had a hard time trying to survive by my own. I had friends, but I couldn't share with them because as humans, we always have this judgmental attitude, and I didn't want to be judged. Hence, I always portrayed that I was very strong, and I am strong, but there are times when I can't take it anymore. But the many nights that I would run and be told by my own friends that, go, just tolerate, it's okay, it's going to be all right. I think I didn't want to die in the hands of my own brother, and I didn't want him to get hurt. And I did my best to save my family, myself, and my brother. Today, I didn't know, this is the first time I'm sharing this very openly on a webinar, but I'm hoping that it will help people who are listening. I sincerely feel that we really need to have the heart of listening and be really honest. Our society needs to be open about this topic. This cannot be dealt or found, you can't find solution in isolation. The funny part is, even within my friend circle, I have so many friends who drink. I am a socialite drinker. And it would be hypocrite to say that, I don't drink. But our Naga society are filled with so many drinkers, but they pretend that they don't drink. And that is the problem. Every shop that you find behind those Bisleris and chips, we have alcohol. And that is the hypocrite life we are living in the state of Nagaland. And we expect the NGOs to clean the message. We ourselves are contributors. I just want to end by saying that as a victim of substance abuse in many ways, but I must say to you that I found healing and reconciliation with myself, my family, and my brother is in a better place where he's finding healing, and it's a process. And it's very important to educate our family how to deal with all these things by having conversation. Family conversation is very important, and to give them the right tool to face these challenges. And I think the church, as somebody has shared, I think Sentina, is the right place to equip families. And another suggestion that I have found when I was discussing this with Ella, that why can't we create, when we have Alcoholic Anonymous for alcoholics, why can't we create for family? We need to create safe spaces for family who are victims to substance abuses to come and share the stories. And only people who have gone through can guide one another. But we need to find healing, and we need to find the root causes. What is creating this problem? As a woman in the state of Nagaland, it is so difficult, and I think it's a very common problem in the world. Women are the most who are at the receiving end of everything. And we are told to control ourselves. We're told to say tolerate. We're told that, oh, you're the most understanding person. You're gifted. You should be more patient. And anything that is happening to you, it will pass. You need to increase your spiritual life. But at the end, I want to end by saying, my grandfather said this: the Naga society has fed the little boys with so much of pride and ego that they have become tigers, that they're ready to eat and pounce at you. So thank you very much, Nukshi, for giving this time. And I do hope that this has helped, or I don't know, but it's been a real liberating moment for me. So thank you.
All right. Well, thank you so much, everyone. Thank you, Abu. Thank you, all the panelists, Anna, Sentina, Dr. Joyce, Vitono, not Vitoli, and the audiences. Thank you so much. for being in this discussion. I hope, I'm really very, very optimistic about this outcome, and I really hope that something positive will come out of this consolidation. So thank you everyone for everything.